Hey friends, how do I find the right recovery treatment? That is what we are going to be talking about in this video. Please watch till the end, hit the subscribe button. So in a perfect world, the system would be perfect, right? It would guide people in a safe way, an effective way. They would find trauma-informed recovery, but we don't live in a perfect world, unfortunately, and many of the treatment centers are fantastic. Many of them are broke. Many are underfunded, overbooked, maybe not trained in co-occurring mental health issues, trauma issues. So what I would like to share with you, though, is just some of the criteria that addiction counselors use to work on placing individuals into the correct treatment center. So as opposed to just picking up the phone book and calling someone and saying, hey, I need to come in, oh my gosh, I'm an alcoholic, or, a family member is. Knowing some of this criteria can actually help you get into the right treatment center. And it starts with having a good assessment. And so there are many, many, many different criteria to determine the level of care you need. The one I'm going to tell you about today is called the ASAM Criteria, ASAM, A-S-A-M, and a lot of addiction treatment centers use it. That stands for American Society of Addiction Medicine. And so this is a framework used by counselors, therapists, treatment centers to guide the initial assessment and placement process. So it's not just like, hey, are you using drugs, right? Let's stick you in a 30-day treatment program. So this is a lot more involved than that because it's looking at your entire makeup. So we're looking at not just are you using drugs and alcohol, but we're looking at what are the medical risks? What are the emotional needs? What is your motivation for change? How about the environment you're living in? Is there a history of trauma? So the goal is to match you to the right level of care so that you're not just tossed into a program that's not even going to work for you. Okay, so there are 6 dimensions to this. I want to break those down, and they're used in the initial assessment just to figure out, okay, what kind of treatment do you need? And so a big one, of course, is going to be the intoxication and withdrawal potential. So this one, of course, is about safety. Is the individual currently detoxing? Because a lot of people don't know that withdrawing from alcohol can actually kill you. So a lot of people need like serious detox. You can't just say, hey, just quit a lot of times so this detox thing is very important depending on the type of detox that you need. Because alcohol and benzos, for example, require a medical detox. My brother, before he passed away, was an alcoholic, and so he often had to go into medical detox so that he wouldn't seizure out. So if this is missed, people can end up in, outpatient programs where their health is at serious risk. Also, we're going to look at biomedical conditions, complications, things like that. So things like your physical health. Is there a chronic illness? Is there pain? Stuff like that, because it can get kind of tricky. For instance, if you're using opiates or, a lot of people come in for, opioid treatments and things like that. And it may have started with a back injury and they were given pain pills. They were given opiates. So now they're addicted, but they still have chronic pain. So how do we work with that? Is the individual pregnant? Is there liver damage? Things like that are going to be very important because those are all part of having a full recovery treatment. Okay, so these things aren't just going to go away right when we enter treatment. Some things will go away. Some things will go away quickly, and that's great. But these are types of things that can't be ignored. Now, God doesn't just heal the addiction. He heals the body, the mind, the soul. Psalm 103, he forgives all your sins and heals all of your diseases. Okay. So number 3 is going to be assessing emotional, behavioral, cognitive conditions. Okay. So this, of course, is the mental health. So is there co-occurring mental health challenges? Basically what this means is, in addition to struggling with alcohol or drug addiction, is there another condition? Almost everyone that struggles with addiction, there's something else going on. There's anxiety, there could be post-traumatic stress disorder, there could be depression, there could be bipolar, autism, ADHD. I was having panic attacks and things like that, had anxiety and stuff since I was 14 years old. So the alcohol I was using to treat panic disorder. Does that make sense? The other thing that we'll talk about a little bit is I'm dyslexic. And so as a kid, that's neurodivergent. So they're going to look at ADHD and stuff like that. Typically, unfortunately, not dyslexia. And I have quite a few shows about this because it is a real challenge, because so many people that struggle with addiction are also dyslexic. And so this can impact the type of recovery that you may need, or the type of group that you may need, or the way in which maybe you need to be communicated with. So there could be different communication strategies. For instance, as someone with dyslexia, I'm a very visual learner. All right. If you are a trauma survivor, you might shut down in a loud confrontational group. Does that make sense? And then, of course, obviously, different types of counseling, trauma-informed care. There may need to be some anxiety medication, things like that, if you're having panic attacks, if you're having severe depression. So that's number 3, looking at the emotional, cognitive. Number 4 is readiness to change, right? Do you want to change? Are you somewhat ready to change? Or did your mom say, get into treatment or you can't stay in the house, or something like that? So, and we know this, not everybody who walks into treatment is fully committed, but this doesn't mean that you don't want help. It just means that you're human. But the idea is, how ready are you? This doesn't mean, oh, you're going to get kicked out or anything like that. It's just trying to determine if you're where you are on the scale of readiness to change. And the reason that this is important is there's actually some tools and a kind of a cool thing called motivational interviewing, which is really, instead of casting shame, it's a type of discussion with an individual to help them see some of the discrepancies in how they're living and what they believe. Okay. For instance, well, I don't have a problem. I'm not an alcoholic. I can control it, and stuff like that. It's just that, every time I drink, I miss, my son's, basketball game, my daughter's, volleyball game, and then maybe they get really sad about that. Okay. So you're going to hone in on that and help them to see the discrepancy. Well, I don't really have okay. So what I hear you're saying is that you don't have a problem, but every time you drink, you miss these things that are important to you. And it's like, oh yeah, that's right. So it's a great tool to help people move toward change instead of, throwing shame and that sort of thing on an individual, especially an individual who maybe has underlying trauma, mental health issues. And honestly, that's the last thing that you want to do. So if you or loved ones heading toward treatment, this is amazing. You are strong. You can do this, and keep walking forward. Philippians 1:6, he who began a good work in you will carry it out until completion. Okay. But sometimes that good work, it starts with uncertainty. We know this. Okay. So that was number 4, was readiness to change. We're also going to look at what is the relapse potential for this individual. Has the person tried to quit before and gone back? Has the individual just started using drugs or alcohol, maybe been using for a year? Have they been maybe using heroin for 15 years, right? Things like that. What are some of the triggers? What are the patterns? What are the situations that keep pulling the individual back? Does that make sense? So some people will have a lower relapse potential, and some people it's going to be very, very, very high. And if you have a high relapse potential, short-term treatment, that's not going to be a good idea. You're going to need a high level of care, maybe inpatient treatment. And so we'll get into that too. And then we're going to look at the recovery environment. In other words, if you are doing an outpatient or something like that where you're not inpatient, what does that environment look like? Okay. What is the home situation? Are there supportive people around? Or is there chaos? Is there abuse? Are you homeless? It's very difficult to heal in a dangerous environment. I know one individual, he's trying to stay sober, but he was homeless and living in an area where everybody came and bought heroin and stuff like that. That's going to be very difficult to stay sober in an environment. Like, I would say that is almost impossible to recover in an environment like that. Okay, so these are all really, really important things to assess for an individual, right? We need to look at the whole person. We need to look at what's going on mentally, what's going on physically, what's going on emotionally, what's going on spiritually, all of those things. And if you look at, okay, so for me, I'm sober from alcohol and drugs. Now, I didn't have extreme withdrawal when I got sober, so I did not need medical detox. My brother always would need medical detox because he'd have seizures and stuff like that. Now, biomedical complications, I didn't have too many. I wasn't, pregnant when I got in, but I did have some liver problems. But there wasn't anything acute. There wasn't anything that would put me in the hospital. Now, I was severely, had an anxiety disorder, was extremely codependent, had the neurodiversity or dyslexia. Basically, it just shot my self-esteem. The self-esteem was really low. The self-efficacy, which is one of the most important things in recovery, and that's the belief that I can do it, the belief that I can achieve change, right? We have to believe in ourselves, and a lot of times we need some help, some people to come alongside us. Like they say in AA, believe that we believe. So, this number 3, this emotional behavioral thing, was a big one for me. Readiness to change, initially, once I got into recovery, I did the deal, but I was in and out of AA for a little bit before I actually decided that I was ready to change. That makes sense. Relapse or continued use potential. For me, it was probably pretty low once I finally made the decision to quit. Because this was when I went into treatment, it was the first time that I ever did treatment. So I hadn't been going back a whole bunch of times. Okay. My recovery environment was pretty good because I was single, at the time. Okay. But then also we're going to look at, was there trauma in your past? Is there PTSD? And then also from a genetic perspective. So we're going to look at that as well. So for instance, for environment, I grew up in Alaska where everyone drinks all the time. It's dark. And so many people in my family were alcoholic. Those that didn't stop drinking are, sadly, they've all passed away. So, you want to look at that like, oh my gosh, okay, so this is a genetic issue, so that can determine the type of care. We just went over the 6 dimensions, and then there's the levels of care. So the first one is going to be outpatient. So this means few hours a week of recovery. You're going to be going to some meetings, right? This is for individuals if you have a pretty stable environment, you have a pretty good support system, you have a pretty low risk of a relapse. So basically, what that means is you're not going inpatient. Outpatient means you go to meetings, things like that, but you're still living at your home, wherever it is that you're residing. Then there's level 2. This is intensive outpatient. So this is ramping it up a little bit, more meetings, things like that. Okay. So, and this is where you need some, you have somewhat of potential for relapse. There's some complications there. You don't really need 24/7 care, but you need a little bit more help. So they call this intensive outpatient. Then there's residential or inpatient, and these are the live-in programs, the around-the-clock support. And this is great for people who need to get out of toxic environments, people who have a high risk of relapse, stuff like that. Okay. So, because so many people, I remember when I was working at an opiate treatment center, so often people coming in, to get the methadone and stuff like that, which, by the way, they should be encouraged to be titrating, to be working their way off of the methadone. But you could look and assess and realize, oh my gosh, like this individual needs some really hardcore inpatient. They need detox and inpatient treatment. But again, it can only be encouraged, right? An individual needs to want to do that. But you see what I mean? A lot of times the treatment doesn't match the type of addiction, the level of addiction. And so if we're not getting the right care, it's going to be hard to get and stay sober. So we've got inpatient, residential, then there's medically managed intensive inpatient. So this is the hospital level care. This is for people with serious withdrawal risks. This is for individuals with life-threatening medical and mental health challenges. Okay, so the point is to tailor the treatment as best as possible so that not everybody gets a cookie cutter program, because right, we're all so different. So like, let's look at a little case study. We'll call her Shannon. She's 34 years old. She's been struggling with alcohol and pills for about 5 years. She's had a prior stay in rehab, relapsed within 3 months. So here's her score. Dimension 1, withdrawal risk is high. She admitted she's drinking heavily every day. She could be at risk for seizures. So Dimension 2, biomedical moderate. She has a liver issue. Hasn't been to a doctor in a year, so want to look at that. Emotional, Dimension 3, mental health, pretty severe. She has untreated PTSD from childhood trauma and depression. Readiness to change, that's Dimension 4, low. She came into treatment because her family gave her the ultimatum, right? So not my idea. Right? You know, get help or we're cutting you off, Not that that's a bad reason to get into treatment. It's just that the work begins with getting her ready to change, right? If we just throw the book at her, here, read it, do this, she's like, oh, okay, going to go through the motion. So understanding that is really helpful. And then what is her relapse risk is pretty high because she's tried to quit so many times, but always goes back. So based on that, where should Shannon go? So we're going to say residential treatment, level 3. So this means that she's living in a full-time treatment center. She's got some medical detox. She's got trauma-informed therapy and some structured care away from home, away from the dangerous environment that she came from. Okay. And so then later, as she gets better in treatment, moves along in her treatment, could be moved down to level 2, which is intensive outpatient. So you can see that she doesn't just need to stop the addiction. She needs to stop safely with healing, with support, with a chance to deal with the pain. And so there's definitely a gap between this, theory and reality again. This criteria in a perfect world would ensure that everyone was matched exactly with the care that they need. Unfortunately, as I mentioned, that's not always the case. It can be. Oftentimes it's not. Oftentimes people come into treatment, they have very little resources, particularly if they're homeless or they don't have a supportive environment. They don't have insurance. A lot of time insurance, is only going to pay for some lower levels of care. Again, a lot of programs are underfunded. Many of the staff individuals may not be trained in trauma or mental health, or there's a real shortage of that. So there's some addiction counselors, but a real shortage of mental health therapists. So what do? You kind of have to be your own advocate. And you want to call around and find the right place. And you want to find someone who can do a good assessment based on the things that I just told you about. It doesn't have to be, the ASAM criteria or whatnot, but you really want to be assessed on all of those things, right? The physical, the mental health, relapse potential, how long have you been using, how many substances, what mental health challenges, is there stuff co-occurring, is there trauma? So these are things that are really important. So, ask, do you offer trauma-informed therapy? What kind of therapy do you offer? Do you do assessments for these co-occurring disorders? What support is available after discharge? Because this is huge, right? Because individuals get out of treatment, and then what? Is there any support after that? So if you don't get the answers, keep looking. God is going to lead you to the right place at the right time, but He's going to give you wisdom if you seek help, if you speak up. You want to be able to advocate to get the right treatment that you need, because you are worth it. You are worth recovery. Because addiction is not just a chemical issue, right, friends? It's mental, emotional, spiritual, relational, all of these things. So healing is possible. It takes time, it takes wisdom, it takes persistence to find the right kind of help. But don't give up, because you are worth fighting for, friends. Do not give up. So thanks for watching. I hope that this has helped you, and keep watching and check out this channel for all kinds of stuff on addiction, recovery, and mental health. And please hit the subscribe button, friends, and click like on this video. And again, don't give up. God bless you, friends. And thank you so much for watching.